Defence Minister Rajnath Singh dedicates 2 BRO centres of excellence to the nation. Dr. Harshvardhan addresses 75th session of UNGA, says India is with the world in the fight against HIV. Union Minister Kiren Rijiju launches a distribution campaign of Ayush 64 tablets and Ayurvedic medicines in Arunachal. Nagaland launches pneumococcal conjugate vaccine for children below 5 years at Kohima. And UEFA Euro 2020 football tournament begins tonight with Turkey taking on Italy. Good evening, viewers. Welcome to the Northeast News Bulletin from the studios of DDK Guwahati. This is Jolly Khoikia Gogoi with the stories in detail. Defence Minister Rajnath Singh dedicated 2 centres of excellence established by Border Roads Organisation to the nation at the Seema Sarak Bhavan today in New Delhi. These centres have been established to achieve excellence in road safety as well as foster growth in construction of roads, bridges, airfields and tunnels. Launching 4 software on the occasion, the minister said these will bring more efficiency in the work of the organisation. Meanwhile, he lauded the workers of Border Roads Organisation for their commitment and tenacity in nation building.
साथियों, अपनी स्थापना के समय से ही बॉर्डर रोड ऑर्गेनाइजेशन दूर दराज के इलाकों में रोड्स, टनल्स और अन्य बुनियादी ढांचे का निर्माण कर राष्ट्र की प्रगति में अपनी महत्वपूर्ण भूमिका का निर्वाह कर रहा है।
Health Minister Dr. Harshvardhan today said India is with all the nations in the fight against the deadly HIV disease. He was addressing the 75th session of UNGA on prevention of HIV/AIDS. He said India is providing free antiretroviral treatment to close to 1.4 million people, but however stressed that there is need to achieve zero new transmission of HIV to fulfill the promise of ending AIDS in the next 10 years. The minister further informed that India's National AIDS Control Program has been revised, revived and revamped to focus on hard-to-reach and risk populations.
Customize our program, share knowledge, emulate best practices and stride towards reaching the sustainable development goal of ending the AIDS epidemic, which is a grave public health threat by 2030.
Women and Child Development Ministry has urged people to not share information on social media about children found abandoned or in distress, as it can put the child's life at risk. Keeping the pandemic in mind, several children have been witness to facing serious distress in the events of parents getting infected or hospitalized due to COVID. Meanwhile, some of them have lost their parents to the disease. The ministry urged for such information to be reported to Childline on 1098. Union Minister of State for Sports and Youth Affairs and Ayush, Kiren Rijiju, launched a distribution campaign of Ayush 64 tablets and Ayurvedic immunity-boosting medicines for COVID-19 patients amid the pandemic at Itanagar on Thursday. He also handed over testing and screening materials for COVID-19 to the Department of Health, Arunachal Pradesh. The minister lauded the state government led by Chief Minister Pema Khandu and entire team Arunachal for achieving remarkable success in combating COVID-19 despite many challenges.
अभी कोविड का तो वैक्सीनेशन चल रहा है, ये तो आपको रेजिस्ट करने के लिए, बॉडी को एंटीबॉडी करने के लिए, लेकिन अभी तो इसका इलाज ऐसा टाइम लग रहा है। तो इसमें आयुष 64 और जो काबासुरा कुदिनीर है, जो यहाँ नहीं है, वो सिद्धा का है, ये इतना इफेक्टिव पाया गया है कि moderate, mild and asymptomatic cases is being best treated by the Ayush 64.
In the COVID update from the country, the active case load has further declined to over 11,21,000, in lieu of which the national COVID recovery rate has improved to 94.93%. As per data from the Health Ministry, over 1,34,000 patients have recovered in the last 24 hours, with which the total number of recovered cases in the country now stands at over 2,77 lakh. Meanwhile, 3,403 deaths were reported in the last 24 hours, taking the total death toll in the country to over 3,63,000. However, under the nationwide vaccination drive, over 24.6 crore vaccine doses have been administered so far. In the COVID scenario from the northeast, Arunachal Pradesh has reported a caseload of 3,209 active cases, while the number of cured cases were logged at 27,150. The tally for the dead stands at 133. Assam has a count of 47,081 active cases, followed by 3,97,929 released cases. The dead accounted for 3,844. Reporting 9,359 active cases, Manipur records 47,797 released cases. The dead tallied at 925. Meghalaya has notched up 5,015 active cases, followed by 34,867 discharged cases, while the death toll is 704. Mizoram has a caseload of 3,578 active cases, while cured cases logged at 11,104. The dead account for 61. Logging 3,877 active cases, Nagaland has a count of 19,032 cured cases. The tally for the dead is 441, while Sikkim has logged 4,040 active cases. Released cases stand at 13,624. The death toll is 279. Lastly, Tripura has 5,844 active cases, while the cured cases accounted for 51,653, and the tally for the dead stands at 596. Manipur Chief Minister N. Biren Singh, in a tweet today, thanked the U.S. Centers for Disease Control and Prevention, India, for their contribution of COVID aids to the state. Manipur has received around 29 oxygen concentrators, over 1,000 each of face shields, goggles, aprons and sanitizers. Likewise, N95 mask and 3-ply mask were also received in large amounts. The minister said this initiative will be of great help for the frontline warriors. The Meghalaya government has revised the entry-exit protocol for the people entering the state. It is now mandatory for all the people to register themselves prior of their travel at Meghalaya online COVID testing portal and to download the Arogya Setu app and the Behavioral Change Management app of Meghalaya on their phones. RT-PCR testing is mandatory for all entrants to the state, irrespective of whether they have a COVID negative certificate. People who have the final vaccination certificate, however, are exempted from testing. Persons who enter and exit the state on the same day are also to be tested, and the results will be communicated to them. Pneumococcal conjugate vaccine (PVC) for children below the age of 5 years was launched today by Nagaland Principal Director Health and Family Welfare Dr. Nekharelieli Kimiao at the Primary Health Center Kohima. Dr. Kimiao said that the vaccine will play a crucial role in protecting precious lives from various ailments present in the society. He also thanked the state government for taking special initiative in ensuring availability of the newly developed vaccine to the general population. The new injectable vaccine PVC will be available in liquid form and will be given in 3 doses.
Basically, this is to prevent chest infection. We call it pneumonia. It is a group of bacteria which called Streptococcus pneumonia, which causes chest infection as well as meningitis.
The UEFA Euro 2020 football tournament begins tonight at 12:30 with Turkey taking on Italy in a Group A encounter at the Stadio Olimpico in Rome. For the first time, the tournament is taking place in 11 cities across Europe instead of 1 or 2 countries, despite the lingering shadow cast by the COVID-19 pandemic. Cristiano Ronaldo's Portugal are the defending champions, but world champions France will start the tournament as the favourites. The tournament was delayed by a year due to the pandemic. Meghalaya Education Minister Lakman Rimboe said the centre's performance grading index report is an eye-opener for the state government to further improve the school infrastructure and quality of education in the state. Meghalaya has been listed as one among the worst performers in school education as per the report released by the Union Minister of Education, Ramesh Pokhriyal Nishank. He said that the state was given 649 out of 1,000 points by the Government of India. Meanwhile, Rimboe also informed that the department will review the status of the SSLC and HSSLC examinations scheduled for June 14 and also on the schedule for the remaining papers of the HSSLC examinations.
That's why our score is 649. And what are the initiatives which we are doing last year? Because this is a report of 1920. What we are doing last year and this year, it will reflect in the next report.
The Education Ministry has developed an online module for compiling out-of-school children data identified by each state and union territory and map it with special training centers on the Prabandh portal. Union Education Minister Ramesh Pokhriyal Nishank has informed that child-wide information of the identified children and the special training centers for them will be uploaded at block level under the block resource coordinators. Now, before we end the news, the headlines once again. Defence Minister Rajnath Singh dedicates 2 BRO Centres of Excellence to the nation. Dr. Harshvardhan addresses 75th session of UNGA, says India is with the world in the fight against HIV. Minister Kiren Rijiju launches distribution campaign of Ayush 64 tablets and Ayurvedic medicines in Arunachal. Nagaland launches pneumococcal conjugate vaccine for children below the 5 years at Kohima. And UEFA Euro 2020 football tournament begins tonight with Turkey taking on Italy. And that brings us to the end of this evening's bulletin. Thank you for tuning in. Namaskar.